looking back to 5 years ago, it's a bit surreal because I was following what was happening with COVID from since it started in Wuhan. And we knew that if it was a respiratory virus, then we had to take actions to prevent or at least delay the transmission. Unfortunately, the then government, APNU AFC government, did not put any mechanisms in place after the first case. And so the person who was first diagnosed on the 11th of March 2020 was actually the first time that they did a PCR for patients. So imagine doing the PCR and finding your first case, which means that they weren't ready. We don't know before that how many other persons were probably infected with COVID that we didn't diagnose. Some of those persons probably died and we had no clue. So the first case, it also showed how unprepared we were, because that person came in and it was only, they took out a random sample to just verify, and then they discovered it. In the meantime, 50-something healthcare workers came in contact with that patient from the time she came into the accident and emergency. And of course, because not much was known about the disease at the time, those 52 persons had to go into isolation and to wait at least a minimum of 2 weeks to see whether or not they developed symptoms. So it shows that at the time, the government then was totally unprepared to manage COVID. They didn't put the necessary things in place, whether it's acquiring PPE or, giving people information so that they can follow or encourage people to use masks and so forth. They did not do any of those things. We took several measures. So the first one was to get an understanding of what was happening with COVID throughout the country. So we instituted a morning meeting that started at 7 every morning and would go on maybe 8, 9. And by doing that meeting, we had everybody online, all the RHOs, the lab people, everybody that had to manage COVID. So we were able to understand what problems the regions were having and to solve the problems immediately in the meeting, whether we need to deploy extra resources or so forth. So I think by having that coordinating meeting, that helped tremendously. And we did that every single morning for close to 2 years. Whether it was a holiday, or Saturday, Sunday, we did that for about 2 years. So that was one thing. The second thing was that we wanted to make sure that we had preventative measures in place. So we introduced masking, and we started first with having cloth masks, but eventually, as we were able to acquire PPE, we had that distributed extensively. We also encouraged people to learn more about the different types of masks. So those that were 3-layered, those that were 5-layered, and explain the differences and so forth to them. While we were looking at the preventative side, we also had to scale up testing. So we ensured that tests were available at all the regions or regional hospitals. And we moved from doing PCR to doing the more rapid types of tests. And we ensured that adequate supplies were available across the country. And so that helped with our diagnostic capabilities. We also start actively looking for treatment. So the people who needed hospitalization, to put a system in place, if they needed to be hospitalized, that they would be hospitalized in adequate facilities. And in some instances, we had to make sure that we had a place to isolate people. So we did that for regional hospitals, but we also made sure that if they had a deterioration of their condition, that we can move them quite easily to the the infectious disease hospital. That hospital, we had to build it out. So when I took over, there was nothing there in the facility. And within a month of me taking over, we had rectified that and had our first patient in that hospital. We had to buy a lot of ventilators because we didn't have enough ventilators in the country. And we ended up procuring maybe between 50 and 100 ventilators from different sources. And we ensured that all our regional hospitals, the main hospital, they had ventilators. And we taught people how to utilize these ventilators. And I think that prevented a number of deaths. We also had to scale up provision of oxygen because many of our facilities, we didn't have adequate oxygen. So we had to buy oxygen and send them out and make sure that they had sufficient quantities. And at the COVID hospital, we started out with gas bottles of oxygen. We eventually had a big tank. And then eventually we were able to put in an oxygen plant at the hospital. We also work with several partners to do oxygen concentrators and deploy those to different regional hospitals. And that helped us to be able to adequately provide for oxygen. In addition to all of this, when vaccines became available, we moved to quickly get vaccines. And we started out with the AstraZeneca vaccine that we got a donation from India. And those vaccines, we were able to vaccinate our first-line healthcare workers. And eventually we got some more, and that's how we started our vaccination program. We then had to look around to see what other vaccines were available. At the time, it was extremely difficult to get Pfizer vaccines or Moderna. At one time, Moderna was only for the US domestic market, and they weren't giving it to the international market. And we look at various options on how we can access vaccine. We became part of COVAX so that we can access vaccine. We had several bilateral meetings with different countries to see whether or not we can get donation of vaccines. And through all of these mechanisms, we eventually start getting some vaccines into the country. We were perhaps one of the countries that used a wide variety of vaccines because we started with AstraZeneca. We also had J&J, we had Sputnik, we had Sinopharm, and then eventually we got Pfizer and Moderna. So these were the different types of vaccines that we utilized. For first dose, we were one of the few countries in the Caribbean that got to almost 88% of people having coverage. Second dose was a little bit off. We had about 68%. But even that was very high compared to other jurisdictions. So I think the measures that we put in place and the kinds of education program that we had in place saw that a lot of people took the vaccines. And I personally believe because of the wide vaccination coverage that we had, that resulted in lower rates of deaths in Guyana. We, during the period from then to now, we've had maybe about 1,200 deaths. Comparatively with other countries, that's relatively low. We ended up having about 60-something thousand people being hospitalized over the period. And again, most of those people survived COVID. There are, of course, some people that ended up with long COVID. They had various challenges, and we had opened a clinic to deal with long COVID. But from a medical point of view, all that we could have done for our patients, we tried to do it. And in some cases, the meds that we are using were what was being used in the developed world. We were one of the first countries to introduce Paxlovid. This is a medication that Pfizer had put together, and we were able to use that with our patient, and we saw that that reduced the time for people who were infected. So lots of good health measures. We put in place a lot of good public health measures, and also we were able to scale up diagnosis. We were able to offer treatment, and because of all these measures, we didn't have that severe impact that other countries would have experienced. And of course, during this period, we would have been able to build our capacity to monitor the different types of strains of COVID that were circulating, because we were able to develop capacity to look at gene sequencing of the different types of COVID.